Hey guys, you're probably here because you want to know all about those styes, why we get them, how to get rid of them, and most importantly, how can you prevent them from coming back? Well, I'm going to answer all of those questions, along with many other questions in this week's Responding to Your Comments, where we look at fun questions, we look at science-based questions, but most importantly, we always look at the evidence. So what are we waiting for? Let's do this. Poco, watching this video with one eye, could you please do a video on styes and their treatment? Poco, thank you for your comment. I hope you are much better now and you've recovered. This comment is from the blepharitis video that I did a while ago. Of course I can do a video on styes. It might be a little late for you, but you never know. It might be the right time as well. And I hope it helps you. I hope it helps anyone who's watching. And at the end of this video, you guys are all gonna become Stye pros. Okay, so first let's begin with a little bit of background because this is going to help us when we start to discuss treatments. So styes, they usually go on their own within about a week or two. They can be very painful, unfortunately, but the good news is they're not usually a sign of anything serious for you to be worried about. But the bad news is, unfortunately, they don't look very nice either. So the next question is, how do you know if it's a stye? Well, a stye is a localized infection, so it's a small, painful lump on or inside the eyelid or around the eye. Now, it may also be swollen, it may also be red, and it may be filled with a yellow pus-like pimple. And sometimes your eye may be red and it may be watery, but please remember, your vision should not be affected, so please do remember that. Now, another good way to see if it's a stye or not is by looking at images. These can be very helpful for eye conditions. So what I will do is I'll leave a link to the NHS page in the description below. They've got loads of great images on there, so you can have a look at it if you want for more information. And I'd highly recommend actually that everyone does check it out. Now, please remember that styes only usually affect one eye, but they can sometimes affect both eyes. Also, it's probably not likely to be a stye if your eyelid has no lump and, for example, your eye or eyelid is swollen, red, and watery. It's more likely to be something like conjunctivitis or blepharitis. And lastly, if the lump on your eyelid is hard and not very painful, then it's probably more likely to be a chalazion. Now, fear not. I'm going to leave loads more information and loads more links in the description below about all of these different conditions. So if you want to find out more information, please read up on them. But what I would highly recommend is you always speak to a healthcare professional first so they can check your symptoms, so they can ask you questions and come up with a diagnosis of what's going on exactly. Now, let's move on to how to treat the stye. Now, when patients have a stye, the first thing that I recommend them to do is a hot compress because one, it's really easy to do, and two, you don't need to buy anything. You've already got everything at home probably that you need. And what it's going to do is it's going to help reduce the swelling and it's going to help the stye heal faster. Now, you may be thinking to yourself, well, how do I do this hot compress? Well, don't worry. Abraham the pharmacist has always got you covered. Very easy to do. All you need to do is get a clean cloth or a clean flannel, anything like that, rinse it in some hot water and give it a good rinse out so it's not too wet, and place it on the eye, the affected eye. Close your eye and place it on the eye for about 5 to 10 minutes. You need to hold it there very gently. That's really important that you're not pressing and pushing too hard on the area. Now, I'd recommend that you do this 3 to 4 times a day, and please make sure that the water is not super hot. You don't want to scald yourself or burn yourself. Just make sure it's a comfortable hot temperature that you're fine with. Also, please remember, when you have this stye, don't wear contact lenses and don't wear any makeup around the eye until the stye is healed. Now, eventually, after doing the hot compress, it's going to draw the pus to the head of the stye, and eventually this will pop, which is fine. But please make sure that you're not tempted to try and pop it yourself. So don't squeeze it or play about with it, because all you're going to end up doing is damaging the delicate skin around the eyelid, which you don't want to do. And also, you could potentially push and spread the infection further and deeper into the tissue. So that's the hot compress technique. As I said, it's very simple and it should be very easy to do. But if you're still in a bit of pain, then painkillers can be helpful for this, like paracetamol or ibuprofen. But please, like I always say, please speak to your healthcare professional first so they can make sure that you're safe and suitable to take that medication. And always read the information leaflet that comes with the medicine, again, to check that you are safe and suitable to take that medicine. So now that we've discussed treatments, let's move on to preventative tips to prevent the stye coming from the first place. But please remember, if you do suffer from blepharitis or long-term blepharitis, then you are more prone to getting styes in the first place. So it's super important, if you have blepharitis, that you maintain good eyelid hygiene. And I discuss and talk all about this in the blepharitis video where this comment has actually first come from. So I will leave a link to it up here and in the description below. If you're interested, check it out. So moving on to preventative tips. Tip number 1, if you wear makeup or eye makeup, please make sure you remove it all before going to bed. And also, with eye makeup, please change it every 6 months at a minimum. Tip number 2, please do not share towels, flannels, face cloths, anything that's going to touch your face and eyes, okay? You shouldn't be sharing any of that. Have separate ones for yourself and anyone else who lives in the same household. Tip number 3, make sure you wash your hands often. And also, avoid touching your eyes or rubbing your eyes if you haven't washed your hands. Basically, whenever you're going to touch your eyes, wash them hands, especially if you wear contact lenses. Whenever you remove them or put them in, make sure you're washing those hands properly. Thank you for the comment, Poco. I really hope this video helps you and anyone who's watching. And like I said at the start of the video, styes are usually nothing to worry about. They're usually nothing serious and they usually go away after a week or 2. But please do remember this. If your stye is very painful or it's very swollen or it doesn't get better after a few weeks, or it's affecting your vision, so your vision is getting blurred or you have visual disturbances, then please make an appointment to speak to your healthcare professional as soon as possible. Once again, thank you for the comment. Really hope these tips help. And if you have any of your own tips, please leave a comment below too, because I'd love to read it, and I'm sure everyone watching this video would too. Now, let's move on to the next comment. Driving with biscuits, great content and entertaining. I am, however, jealous of those amazing cheekbones and natural highlight glow. Bradley Cooper, give this man a shout out, bro. Driving with biscuits, thank you for your comment. This is from the How to Boost Your Energy video. If any of you haven't seen that video, it's a fantastic video. And in the video, I think I talk about a pill, a magic pill that's gonna give you energy. And then I talk about exercise, that relates to exercise. And then I think I talk about Bradley Cooper and Limitless. Really enjoy that movie. Massive fan of Bradley Cooper as well. But thank you, Driving with Biscuits. Thank you for your compliment about my cheekbones. I've never really noticed about my cheekbones, but thank you. And my natural highlighted glow, but I can promise you that natural highlighted glow is just my greasy, sweaty skin from filming in these warm clinic rooms, because you guys don't know this because you can't feel the temperature, but the UK is cold, but our surgery is the warmest surgery I've ever been in. Whenever I come in these rooms, the radiators are always on full blast. A lot of the windows unfortunately don't open, so it's so hot in here, and so that natural glow is, you know, as a result of excessive sweating from the heat. Thank you for the comment again, Bradley Cooper. I told you, mate. I said to you in the last video, I said, give me a shout out if you want me to come and help you out in your next movie. You know, I'm more than happy to come and be the pharmacist or something like that, you know, in a part that you need me. But I still haven't heard back from you. And you know, it really did upset me. But thanks for the comment. Let's move on. Stop You're Annoying. By the way, that's the username. It's not the comment. I never brush my teeth and your channel has encouraged me to start brushing my teeth. I got gum disease, minor disease, but it's painful for me to brush every day. So like, reply if you are here because you don't brush. Stop You're Annoying. Thank you for the comment. I'm really struggling to say your username because I just feel really rude saying it. Obviously here in the UK, we are very polite and, you know, we always like to be respectful to one another. But thank you for your comment. This is from the How to Brush Your Teeth video featuring Dr. Erson, a good friend of mine who's also a dentist. And I'm really glad that the video could help you. And at least you're now brushing your teeth. Please everyone, brush your teeth. Watch the video, there's some really useful tips on there that a lot of people don't know about. You know, for example, a lot of people rinse their mouth out with water straight after brushing their teeth, or they use a mouthwash straight after brushing their teeth, and a lot of these things shouldn't be done. And I feel like we need to make more people aware of these kinds of things. And a lot of people comment saying that they didn't know a lot of these things. And I imagine it's also because a lot of the times I think it's quite difficult for a dentist to speak to a patient in a clinical setting because like usually here that they're all so busy as well, and it's difficult to give all this information because it is a long video as well. I think it's like 10 minutes long. So if you imagine every single patient getting all that information, and also you have to remember this, if you give a patient information in a consultation, they're only really going to remember 1 or 2 things from that consultation. This has been proven, by the way, I'm not making this up. So having it in a video, giving people the option to rewind and watch stuff again and go back to it whenever they need it, that, my friends, is the beauty of YouTube. And it's the beauty of what I do, I guess. And that's one of the reasons why I love doing what I do so much. So thank you for your comment. I'm glad my video helped you, and I hope the gum disease gets fixed. Sending awesome vibes. Trumbull research, lol, plot twist, employee comes around the corner. Sir, who are you and why are you filming in our store? Trumbull research, thank you for your comment. This is from the how to treat and prevent gout video. You know, that would be quite funny if that happened. That's from back in the days when I used to film in pharmacy, in community pharmacy, when I used to work in community pharmacy as well. I no longer work in community pharmacy, I only work in GP practice now, in the medical practice. But yeah, it was always really difficult filming in the community pharmacy setting because there's so many people there. They're all working as well, and they're all loud, and there's always sounds and telephone ringing and everything. And anyone who films videos on YouTube or does any filming knows that sound and people interrupting and things like that is the worst thing for filming, because then you guys who are watching complain about the audio quality being terrible and you not being able to hear me. But yeah, it would be funny though if someone just came around and said, yo, what are you doing here? Do you actually work here? I'd be like, But yeah, that wouldn't happen because I'm a real pharmacist. Sending you all awesome vibes. Let's move on to the next comment. Daniela Harrison, totally new to nasal sprays, and I was expecting to feel the same as when you get water up your nose, so I was reluctant to use it. Absolutely not the case. Thank you for the instructions, really eased my worries, and now I'm a new woman. No more headaches from hay fever. Daniela, thank you for your comment. This is from the how to use a nasal spray video, and I am so glad that I can help you. And like I said before, I've said it many times actually on responding to comments, I'm so happy that I can help people from YouTube by doing these videos. You know, the fact that I'm doing these videos, you guys are able to watch it, you're able to seek advice from a healthcare professional where I inform you of stuff, make you all more aware of medical conditions or how to use a nasal spray or anything like that, and knowing when to seek medical advice as well. So I'm empowering everyone with this useful knowledge. And Daniela here, well, she's a new woman because of it, and that she now knows how to use the nasal spray properly. Now, she could have gone to a community pharmacist or a healthcare professional to ask them, but realistically speaking, 1, do they have the time to go through everything in detail with them? And 2, how much of that are you going to remember? You know, even if I did a consultation with you right now watching on how to use a nasal spray, I guarantee you at the end of it, you're not going to remember everything, because in person, it's very difficult to remember everything and to do it in the right order, to do it nicely and clearly. So that's why YouTube's so great. That's why I love YouTube so much, because when I get these sort of comments, it really makes me happy, and I'm just happy that I can help you. Thank you for the comment. Shivank Namdev, sir, may we know the skincare products that you use? Shivank, thank you for your comment. This is from the how to shrink pores and how to get rid of pores video. Of course you can know, you know, I don't hide this kind of stuff, but realistically I really don't think I have like great skin quality or anything like that. But if you really want to know, I use a daily moisturizer which has a UVA 5-star protection and SPF 30 in it every single day. So I'm using a sunscreen every day to help protect my skin from sun damage and aging, and it really helps. So, you know, I've spoken about sunscreens before and how important they are, because unfortunately a lot of people don't really think about sunscreens much. They think, oh, sunscreens are just for when you go on holiday or just for when you're out in the sun or on the beach or stuff like that. But realistically speaking, we should all use a sunscreen for our face and our neck and our lower neck over here if it's visible to the sun, or even if you live in a cloudy country like the UK where it's cloudy and rainy most of the time, those UV rays still go through the cloud, which means that your skin is still going to get damaged by those rays, which equals aging of the skin and just less, healthy skin. So wear a sunscreen every day. I've said it in loads of videos before, but if you're really interested in how to buy a good sunscreen and how to know what to look out for when you go to a chemist, because buying expensive sunscreen doesn't necessarily mean that you're buying the best sunscreen. You need to know what to look out for, what ingredients to look out for, and what information you need to see on the bottle. And I speak about all of this in a video on how to pick the best sunscreen or something labeled like that. I will leave a link to it up here for you if you're interested. Check it out. Thanks for the comment. So it looks like we've run out of time again in this week's episode of responding to your comments. If I didn't get back to your comment or question, I'm really sorry. We are getting so many comments, so many questions these days, that it's very difficult to fit them all in one episode. So the best advice I can give all of you is keep on leaving those comments. Leave the comment after this video, leave the comment after the next video, leave a comment on every single video, and eventually, I promise, I will get back to you. Thank you for watching this week's video, and as always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.